Hey guys, this is Dr. Tim here with Optimized Wellness Center. Today I'm going to be sharing with you a whole host of information about how to prepare for coronavirus and what is it and what should you be doing and how can you take care of yourself, your loved ones, and your community. I'm going to provide you a handful of really actionable tips that you can utilize and some resources that you can use for yourself and for your family and loved ones in addition. There is so much information out there, and I want to help to create some clarity around this and help provide you some confidence of what you need to do going forward. So in this talk today, I've given this talk before, and so I'm going to be reviewing much of the notes again, but I have updated some of this to be relevant for today and where we are. We're going to be reviewing how to put Slack into the system. What exactly is coronavirus and COVID-19, and is it a pandemic? Also, we're going to talk about transmission, testing, symptoms, and what do those look like, and what do you need to know relevant to that? And then more importantly, we're going to spend some time trying to review mechanisms that you can employ to prevent any kind of infection, whether it's viral, bacterial, pathogenic, or otherwise. In this instance, we're talking about viruses, in mechanisms to boost your immunity so that you can keep your body as healthy as possible, as well as infection control. That meaning in this context is your environment. How can you manage that? Also, we're going to talk about mechanisms to be able to communicate with your community and loved ones if there is a disaster, and if for some reason communication services go down or they're spotty or shoddy. And this can be utilized for other kinds of natural disasters as well. We've provided well over 45 different references and a handful of other resources. If at any time this information is helpful for you, please reach out to us and we can share this with you so that you can have that on hand and utilize it again. Again, also, this is informational only. I am not trying to diagnose anything. If you believe that you have flu-like symptoms, which seem to have become more like a pneumonia or seem to be similar with some of the things we're going to review in a moment, it's important to call your healthcare providers. Of course, you're welcome to contact us, but it's also important to contact your local providers for whom you trust and you're working with. So I have my notes up here and I'm going to be scrolling through them, so just bear with me as my eyes may be darting back and forth. So with all the disinformation about coronavirus out there, how can you decipher what is the truth? Well, we're here to help. We're here to help provide some clarity and to give you the confidence so that you can go forward and you don't have to live your life in fear. Now, don't panic. It's most important that you get prepared so that nothing will catch you off guard. And we're going to go through what that looks like in a moment. Yes, preparing is just simply your responsibility. Each and every one of us, it's your responsibility to be prepared. Also, having a plan in place of how you'll care for yourself or sick family members, especially someone who may be elderly or is immunocompromised. Their immune system already has some kind of issues going on that are chronic and depressing their ability to be able to thwart viruses in this instance that we're talking about. So again, we're here helping the sick get well and the healthy excel, and we will assist you with that. I am, by the way, Dr. Tim Heath with Optimized Wellness Center, your premier health and wellness center of the Bay Area. I have spent an inordinate number of hours researching about viral infections, and in particular, COVID-19, and how people can create strategies to be the best that they can be. That meaning trying to improve their immune system and the ability to thwart things like this as best as possible, but to be prepared and confident and have the right information. So I'm going to be imparting and sharing that with you today, okay? All right, so let's get started. So flu hysteria has now transformed into coronavirus hysteria. It really has gone rampant. You turn on the news for just a moment and it will be everywhere. I'm sure everyone already knows that. And I am trying not to feed that, but also to provide you clear, documented, honest resources and information so that you can feel confident in going forward and you're not worried. So we're going to weed the wheat from the chaff here. So, what we're going to be talking about is news around the coronavirus has hit the world by storm, and we are no longer just fighting an epidemic; we are fighting an infodemic. And so, it is time for facts and not fear. And this is the time for rationality and not rumors. This was said by back in February 15th, just about a month ago, by the Director General of the World Health Organization. And I thought that was a really good and prudent quote for us. And it holds true today, in fact. So I want to make sure to try and help provide you all some facts and dispel some of these rumors. So let's get a few things clear and straight here. COVID-19 will spread around the world. It has already spread to more than half of the countries in the world easily. And I believe that it is a pandemic. And we're going to go through the definition of that in a moment so that we can provide some clarity around that as well. And some people will die. More people will die. In your communities, you will see people or you will know of people who will die, more than likely. Yet, importantly, most will live. And this is the good news that really I want to make sure to share with everyone. The vast majority of individuals who get COVID-19 will live. But we need to make sure that we have all the right resources and we're prepared for that. So, Dr. Emma Hodcroft of the University of Basel in Switzerland, who's works in molecular epidemiology, talked about putting slack in the system. And this was such an important concept, the way that it was described. And what I believe was being described was talking about making sure that we have a buffer in a way to be able to have a little bit of ebb and flow so that not everything catches us off guard and everything is reactive. And so this was true with the public mentality, as well as our supply chains and medical systems, and your personal life. And so we're going to talk about some examples of that in a moment. So government agencies are really trying their best to prepare, while they may be a little bit slow to come in getting this up and running in some instances, which is disappointing for sure. They are scrambling to try and get everything on board at this point. And we have to trust that these individuals really are trying to make an effort. Now, we may be able to go back in history and review and see if there were some things they could have done better, but we also have to take some responsibility as well. So, part of what's going to be happening is there's going to be more and more cancellations. We're seeing today that a lot of large events, for the purposes of trying to create social distance, they are closing down many of these events and shutting them down just altogether. And so we're going to see more and more of that. Even some of the airlines have pretty much grounded all of their flights. We're going to see more of that likely happen, is my prediction. And also comments saying that everything is fine, followed by big jumps in large case numbers and sudden announcements of closures. These kinds of things really lend themselves to the hysteria and the panic. And so we need to be honest about where we are and what's going on. And so I think that it's worthwhile that there are some of these closures taking place for the time being. Because we want to dispel any further panic in individuals. And so this can help create slack in the mental state as well by keeping people informed. So preparing for serious illnesses also means freeing up space and beds in hospitals. And so that may mean canceling elective medical procedures. So I was reading something today in my local community here in the Bay Area where an individual is questioning whether they could go in to see their doctor for a routine checkup on some discomfort that they were experiencing. Now, in no way am I trying to belittle or downgrade the discomfort that they were experiencing, but rather this was something that appeared to be able to be managed through the phone. When she called her doctors, they had mentioned that they needed to push back and cancel that appointment. So she called back and she was asking to be seen again, and they recommended, hey, let's do this over the phone. And she was pretty panicked, I think, at that point and demanded to go in. But my point in sharing this story is that these elective procedures or things that maybe are not urgent probably should be handled through the phone, through telemedicine, or pushed back for a period of time so that we can free up the beds, free up the staff, free up the resources for those that are in immediate need. Okay, so by advising people to stock up on some supplies is probably a prudent thing in addition. And this may mean getting some food as well as some other household supplies on hand. Now, this does not mean you need to go out and fill several shopping carts all at once and try and carry it all home, but rather each time that you go out, buy a little bit extra here and a little bit extra there and a little bit extra here and so forth. And that way you can make sure that you feel comfortable and confident of what you have. So this may be another mechanism of being able to do that to help you out in that process. And so I would suggest considering to do that when each time that you're going to the store, and this may be a helpful mechanism for you. Okay, so let's talk about if there is a quarantine or other measures happen. We did see some announcements that this may be a possibility coming forward recently, and so I think it's important that everyone start to consider what would that look like and how prepared are you for that kind of an event. How prepared are you? How prepared are your children, your spouse, your loved ones, your neighbors in the community? If you have elderly parents, you definitely want to consider them in addition. And so there's some very specific and distinct things that would be important to do to be able to prepare for that. And we're going to talk about some of those in just a few minutes down the through this talk here, okay? So that gives you some ideas there. The experts are not telling you to go and stock up on every essential because they're worried that you're going to rush out and you're going to buy everything on the shelves and they're going to completely run out of food and society is going to just collapse. It's going to go sideways. And so because a few days of panic buying and high demands causes even more panic. And so we really want to calm that down. There are resources available. The food, the supplies are there, but we need to make sure that everyone isn't trying to rush out at the same time and going and doing that all at once. Because that will just create more of that same fear and irrationality. Now, if you are sick, you really should consider quarantining yourself. And so we do have some some resources and documents here that you can request and we will provide to you that gives you some really great tips about how to quarantine yourself and what does that look like and how do you prepare for that and who should you be coordinating with. Here at our office, we are asking individuals if they are sick to give us a call in advance, and we can talk through with them as to whether it's prudent for them to still come in, depending on what's going on. And we will take the appropriate measures to be able to deal with it, or if we need to send them somewhere else, or if they simply just need to stay home and rest and follow through with some of the other recommendations we're going to get to in a minute. To help to allow their body the opportunity to be able to recover and their immune system to come back to full status before they come in and break that social distance if they're feeling infirm. So quarantining is something that we're going to see more and more of, more than likely is my prediction, and we all need to be prepared for that. So reach out to us if you'd like some suggestions around that. We do have resources ready to prepare and share with you on that topic in particular. So preparedness is not about doing nothing, but rather it's not about overreacting. And so we want to make sure that you are preparing and putting slack into the system, but that you're not going wild and overreacting. That's going to be a really important piece here relevant to that. And so that was the point of this conversation here in particular. So coronavirus, what is it? So the World Health Organization has described coronavirus as a family of viruses, which includes animals and humans. And it causes what's called as COVID-19. So this is the colloquial term that we're hearing a lot of individuals describing it as. It's not so important at the moment to get into the nitty-gritty of the distinctions of those, but one leads to the other. And, actually our common colds are part of the corona family. And but this is a specific and unique, distinct form that we're seeing today, and it's characterized by what's called as a positive stranded RNA genome. And this is something that's encapsulated with a membranous envelope, and this envelope is part of the characteristics that makes it unique. And so this has been historically studied. These kinds of viruses in this virus family also includes things like SARS, the severe acute respiratory syndrome, and MERS, which was the Middle East respiratory syndrome back in 2003 and 2012, respectively. So, originally the coronavirus was found in China, and many of you already know that. And it has led to instances of respiratory infections, notably pneumonia. Is really where it ends up. But the origins are relatively unknown, and at this point, somewhat not relevant in the immediate instance as it relates to how to prepare. While it will be helpful going forward to try and figure that out so that we can resist any other instances going forward in the future. So I mentioned earlier that we would talk about some definitions and create some clarity around whether this in fact is a pandemic or not. So we're going to clarify some of the terminology right now. An outbreak, many of you probably heard the term outbreak. This happens when a disease occurs in greater numbers than is expected in a community. And it could be just one case, but in greater numbers than we would expect, that could be an outbreak in that singular community. And then you can have an outbreak in different communities. And an epidemic is an outbreak that spreads rapidly to many individuals. So epidemic is more about the speed at which you're starting to see that occur and spread. So the next term is pandemic, and pandemic is an epidemic, which we just defined, at a global proportion. And so this is becoming widespread across different countries and different continents, and essentially it's considered to be worldwide. I would argue we are starting to see that, and so we may start to see a transition in the terminology that's being utilized with folks in the medical community, as well as other healthcare departments and so forth. So pandemic, this is, really, it's especially harmful as it indicates that infection control measures to keep the illness isolated to a region have proven unsuccessful. So this is where we're starting to see it now in many, many different countries. And a pandemic does not indicate the disease has mutated necessarily, or for it to become more dangerous. Yet, in fact, in this instance, we have actually started to see the COVID-19 has mutated. So while that isn't required per the definition, we are starting to see that occur. So as COVID-19 approaches pandemic status, multiple countries are implementing pandemic measures. And so they have these protocols already in place. And so now we're starting to see some of this unfolding, and they're starting to implement these in more significant ways. And so you're starting to hear much of that in the communications, and you can also look that up. And I'm sharing some of this information with you now. And this may not be limited to increased resources to develop treatments, as well as increased resources to provide screening measures to limit the spread of the disease, as possible limiting travel to potential sources of the disease or areas where we're starting to see greater growth, and ensuring that countries have the resources to combat increased number of disease cases. So that's pretty significant that we're already starting to see that occur. So let's talk about transmission. So this is talking about how do we see a disease get from one to the next individuals. And so it's now clear that COVID-19 has a human-to-human transmission. And so this is notable for the epidemiologists who are researching this and trying to figure out how to address this. And it's mainly transmitting through respiratory droplets. So this is when we talk or we sneeze, achoo, and we're seeing some fluids come out of our body, and it has these viral components inside of that, and that may get onto you, and then accidentally people may touch themselves where that may be, and then they're touching an orifice, and they're getting that inside of themselves, and it starts to break down their body. So similar to the influenza, It's spreading through the air with coughing and sneezes. I mentioned close personal contact, such as touching or shaking hands, can actually cause for a transmission of that disease. Our hands are very durable and, in fact, actually resist a lot of diseases. But if we then touch ourselves, that's where, we start to see people getting infected. Touching an object, so that could be touching like a door or railing or some other kind of object or a surface that has the virus, and then touching themselves is also a mechanism of transmission. And there seems to be some very rare instances where there's the possibility of fecal transplant as well. Fecal contamination, contamination where the transmission it may be occurring that way also. That does not mean that your neighbor's toilet in their home is going to be spreading it to you, but it does mean that in locations where we have feces that may be out in the open and people could touch it, that could be of issue. Okay. So I mentioned earlier that the COVID-19 releases this RNA and into what's called as the cytoplasm. It's kind of this fluid area in the cell, and it hijacks the cell's machinery, and then it produces more viral proteins. So it starts to grow and rapidly multiply, and thus these proteins creates a virus inside of them. It releases an enzyme called 3CL, and this protease enzyme attacks the cell's defense mechanisms, and it then makes it impossible for these cells to be able to resist. And so then there's even more of that hijacking process taking place. So COVID-19 has an incubation period that can be many days, even weeks, sometimes even several weeks. 24 days or so was recorded by The Lancet. And so that's concerning, and this is really a problem because health departments in the United States are currently releasing individuals after 14 days. So we have about a 10-day delta between the 24, which The Lancet is recommending or stating, and how many departments are releasing individuals after 14 days. So we've got some concerns there for sure. So the virus, the life of the COVID-19 virus on surfaces can last around 9 days or more. So that's a pretty substantial amount of time. The environment in certain circumstances have to be exactly right for that to occur, but no less, that is a pretty considerable amount of time. This appears to be the virus can spread not only through the air, but with the feces, as we mentioned earlier, which doesn't bode well for sanctuary cities like the Bay Area where I live, as well as Los Angeles and some other locations. So this is going to be a concern going forward for sure. We're starting to already see pretty significant measures in local areas of trying to address this with some of the homeless communities that we have here. A Harvard professor predicted that about 70% of the global population is likely to get infected. This is a pretty stark and concerning statistic or prediction if this becomes true. So it was stated, I think that it is likely we will see global pandemic. If the pandemic happens, 40 to 70% of the population worldwide will likely be infected in the coming years. What proportion is asymptomatic? I can't give you a good number relevant to that. This was an epidemiology professor, Mark Lipstick of Harvard University of Communicable Diseases. And this was stated back on the 14th of February. So the head of the CDC predicts outbreaks in the United States, and we're seeing this unfold already. Not only outbreaks, but we're starting to see what's called as the RO value. This is the rate of spread is fluctuating considerably. In particular, in elderly communities in these closed environments, we're seeing the spread being quite significant. In other communities, we're not seeing it that large at all. The environment seems to be a pretty big factor, as well as people's immunity. Who's in that environment is also another really relevant factor, and one that we need to really pay attention to. So currently, we think that that RO is hovering around 2 to 3, meaning for each individual who's infected, they may infect another 2 or 3 individuals. But there are some other predictions that it may be as high as 10. And so this is, pretty concerning when the CEO of the Coalition of Epidemic Preparedness Innovations, Dr. Richard Hatchett, seems to think that we should predict a very considerably higher number of about 10. Let's talk about symptoms so that you can be cognizant of what to be aware of, because this is really important. So symptoms specific to COVID-19 in some ways are quite similar to those associated with a flu, and even one that transitions to a pneumonia. And then there's some that are a little bit unique. So we're going to go through these now so that everyone has that information, because I think it's important for you to know that so you know what to look out for. All right, so symptoms may vary in severity. Again, I am not here to diagnose anyone. I'm just sharing and imparting information to try and help you out so that you all can be prepared to take care of yourselves as best as possible, but also your loved ones, family members, neighbors, and other individuals that you care for. So current general symptoms include fever, difficulty breathing, impaired liver and kidney function, kidney failure, severe cough, and pneumonia. It tends to start with a sore throat. And this in particular seems to be often a dry sore throat. And so this dry sore throat for around 3 to 4 days, it then begins to enter into the lungs. And this creates what's called as an uncomplicated upper respiratory symptoms, where there may be a cough, that sore throat may persist, there's a malaise, you're just generally feeling down and tired and slow. You may also have a headache and even some body aches, some muscle aches throughout. This dry cough will often occur without a runny nose. So this is one of the unique characteristics, is the dry nature of the dry sore throat, the dry cough, and without a runny nose. Seem to be somewhat unique to this specific COVID virus, and in particular COVID-19 that we're referencing and talking about today. So then it transitions into a mild pneumonia starting around day 5 or 6, where there then is some increased difficulty in terms of breathing. And this often has to do with the fact that we start to get fluid building up in the lungs. So while we weren't having a runny nose or generating a lot of sputum associated with our cough, that fluid tends to be building up into the lungs. And so this is concerning, because then we don't get the ability to get full inspiration and respiration, so breathing capacity. But when fluid builds up in our lungs, and if we're breathing in the ambient air, there's all kinds of stuff in the air, and we may accidentally breathe in, just because it's always around us, some other bacteria, and then we may get a bacterial issue going on top of a viral issue. And this is when it starts to become of much greater concern, where people may get a more severe pneumonia. And so this is what is now called severe acute respiratory infection, SARI, S-A-R-I, where nasal congestion may become pretty significant. And it feels like you're kind of drowning because there's fluid in the lungs, and so you can't get a proper and deep and full breath in. And so this transitions to an acute respiratory distress syndrome, ARDS, and ultimately sepsis and septic shock and death. So that was a long list, and I want to make sure that you all knew that, so that you understood what those steps are, so that you can keep your eyes out. But most importantly, we want to talk about how to get you healthy to avoid anything like this, or if for any reason you happen to have any kind of infirm health symptoms that you're experiencing, we can help you in the process of getting over that. Okay. So I want to reassure you that if you or your child have cold or flu-like symptoms, that there's a chance that you really only have the cold or a flu. And so this is important that you recognize that and not get overwhelmed by that process.